exams and course evaluations and feedback. Okay, we have three objectives for this course. First is at the end of the course, the participant will understand the natural history of diseases and familiar with the concept related to HIV and AIDS. Second, develop a compassionate attitude in looking toward the problem of person living with HIV/AIDS. And the third, participant can contribute to prevent the spread of HIV and AIDS among young people. The course is 2 credit semester unit for participants from University of Indonesia. We will give certificate for those participants who attend at least 10 sessions. The course is 2 days duration, so we have 2 sessions per day. We have 11 sessions and 3 panel discussions, and we have summary and synthesis and final exams. And at the end of the course, we will have the course interactive course feedback. Okay, the session and panel discussion is grouped into 5 issues. First, basic information on HIV/AIDS, where we'll discuss the issues of HIV/AIDS among young adults, and the natural history of the diseases. And the second group, the current HIV/AIDS situation, we will discuss epi situation, global situation, and also epi situation in the Asia regions. Then we will discuss HIV/AIDS prevention, behavioral preventions, as well as biological preventions. And in group 4, economic and psychosocial impact, we will discuss economic impact and psychosocial impacts. And we also have a panel discussion on some perspective and issues. We have 3 panel discussions, one on national impacts, religious perspectives, and issues and human rights on stigma and discriminations. Okay, this is the rundown of daily schedule. We will start at 9 o'clock, and we have 40-minute lecture with no interruptions, and then we will have 15-minute discussions for session 1, and we move to session 2 with 5-minute breaks. Then at the end of, basically the video conference will last for 2 hours from 9 to 11. Then we will have offline discussions for participants from the University of Indonesia. Okay? For inherent site who want to have offline discussion, this is optional. Okay, so PowerPoint slide, handout, list of references, and daily evaluation form can be downloaded from these sites, www.clr, UE, UI, AC, ID, JDLC, News. We would like you to do a daily evaluation, so please download the form now. Okay? Okay, questions specific to the issues discussed during the lectures and panel discussion could be sent by email through this link. But this is mainly for participants from University of Indonesia. But those who want to post a question, please do. This is optional. Okay. Okay. Now we will have an online multiple choice exams immediately at the end of the course in June 4. But deadline for submissions, the participant can submit the exam within 2 weeks. So, but the exam is an integrated part of the learning process. Those participants who want to improve their grade can retake the exams. Okay. We will have an online interactive course feedback at the end of the course. It's a plus and delta session. We'll talk about what do you like about the course. It's a plus, and things need to be improved. Okay, basically that is the introductions. We will come. We have 5 minutes if you have any clarifications. Please, those who want to clarify any information on the course, please do now. Is there any clarification from the introductions? Otherwise, I will switch to Rosen Wong in Bangkok UNESCO sites for her sessions. Okay?
Okay, if there's no question, so we will move to the next speaker. The next speaker is Mrs. Rosen Wong. Mrs. Rosen Wong is the HIV and AIDS Preventive Education and School Health Officer at UNESCO's Regional Office for Asia and the Pacific. She belongs to the HIV Coordination Adolescent Reproductive and School Health Unit, whose work focus on strengthening the capacity of Ministry of Education in Asia Pacific region to effectively respond to HIV and AIDS epidemic. And second, developing and expanding HIV/AIDS preventive education program and creating HIV and AIDS preventive education tools for learning and teaching. Mrs. Wong also has professional work experience in the international development field within the non-profit, private and public sector. Prior to joining UNESCO, Ms. Wong had worked in the area of community health with the Canadian Red Cross in Central America. So, please, Mrs. Wong, this is your time.
Thank you very much. I'm very pleased to be part of this course. And can everyone hear me well?
Yes, thank you. We hear you very well.
Great. I've been asked to speak this morning about why it's important, why HIV prevention education is important. And I think that in order to do so, it's hard to talk about it without introducing what HIV and AIDS are. So I'd just like to give a brief outline of the presentation. The first part is what is HIV? What is AIDS? How is HIV transmitted? How to prevent HIV? A little bit about HIV and AIDS in Asia and the Pacific to give you an idea of sort of the importance of the issue in this region. What is HIV preventive education from UNESCO's perspective? Why is it important? Why are young people at risk of HIV? And a little bit about our work here at UNESCO and HIV. And finally, the goals, the HIV education goals that we are trying to achieve. Next slide, please. What is HIV? HIV stands for Human Immunodeficiency Virus. It's a virus, which means that we can't actually see it with the human eye. And it's human virus, so that means that it can only infect humans and not other organisms like mosquitoes, for instance, which is commonly a question. The HIV virus stays alive in human cells, blood, semen, vaginal fluids, and breast milk. Next slide, please. Human means that it's something that's transmitted from one person, one human being, to another human being. And immunodeficiency means that this virus breaks down the immune system, makes it very deficient or weak. The human body has difficulty fighting against any diseases from this. And virus means that it's a very tiny particle that infects organisms and causes disease. Next, please. And what is AIDS? So AIDS stands for Acquired Immune Deficiency Syndrome, but it's also commonly referred to as Acquired Immunodeficiency Syndrome, so they mean the same things. And this is important. I'm going to talk about what AIDS is in terms of what happens when the HIV virus comes into the human body, but it's important to know here that just because you have HIV doesn't mean that you have AIDS or that you are going to necessarily develop AIDS. A lot of people living with HIV live with HIV for years before, if ever, developing AIDS. So as HIV comes into the human body, it destroys one's immune system, makes it very, very weak, and so a person living with HIV will start to develop related illnesses. Next slide, please. So when you have a number of these illnesses together, it means that the HIV infection has now started to show signs, and what we call in technical terms is now it's symptomatic, means it has signs. And the symptoms become visible in the body in different forms. And the immune system will then stop functioning. And when your immune system becomes so weak that it stops functioning, then you have AIDS. And so AIDS is the most serious stage in HIV infection, and it's a stage in which your immune system is very, very damaged, or it's deficient, and it's not working. Next slide, please. AIDS, so let's break down what AIDS means. AIDS is standing for A for acquired, which means that it's not something that you can get through hereditary disease, through your gene. It happens as a result of an external source, in this case a virus that enters the human body. And secondly, immune deficiency. Immune deficiency means a loss in ability for the immune system to fight against any disease at all. And lastly, why is it called a syndrome? Because it means it's a group of signs and symptoms that come together and give a particular picture of the disease. And it's important to know not every person who has AIDS has the same group of symptoms and signs, so they're different from one person to the other, and so this is why it's a syndrome. Next, please. So now that we know what HIV and AIDS are, it's good to figure out, in this case for all the students here, how is HIV actually transmitted? How does it actually enter into the human body? And there are three main modes of HIV transmission. The first is exposure to infected blood. So that might be sharing needles, or in a healthcare setting, it might be that the blood was contaminated beforehand and has the virus already, and therefore you would get the HIV through blood transfusions. Secondly, it's through unprotected sex, which means here, in particular, vaginal sex and, of course, anal sex as well. And lastly, another way of getting HIV is from a mother who's living with HIV to her infant during either the time that she's pregnant, the time that she gives breast milk to the baby, or while the child is being born or passing through the birth canal. So those are the three main ways of getting HIV, or for HIV to be transmitted. Next, please. And in terms of, I've listed here the 5 ways, of course, the most frequent ways that HIV is transmitted around the world. And I just want to highlight here that these are global, this is global data. So as we all know, in Africa represents the largest numbers of infections around the world. So the data here is somehow more, I guess if the word is biased, but it more applies to the African context overall. And I'm going to just explain that a little bit. So the first is the most frequent form of HIV transmission will be infection during sex between men and women. And the second most frequent way is infection to babies during pregnancy, birth, or breastfeeding. But as I mentioned earlier, this is really more information relating to Africa. So in Asia context, infection to babies during pregnancy, birth, or breastfeeding is not going to be so highly, is not going to be as frequent as in the African case. So it's not as a major concern in this region, at least on the general scale. Thirdly, infections from injecting equipment during drug use. That's the third most frequent way. Fourthly, infection during sex between men. And fifthly, the least frequent is infection in a healthcare setting. As I mentioned earlier, if the health equipment is not sterilized appropriately, or if the blood that's being used in transfusions is already contaminated, then that is a way in which you can get HIV. Next, please. How to prevent HIV? So as I mentioned, those three ways of transmission, of course, how to prevent them is very much linked to those three ways. People need to be aware of the risk factors for HIV transmission, as I just pointed out, and you should be able to make safe choices in your life and be motivated to do so, and to have access to methods of HIV prevention, which I think other speakers will be going into later on in the course, and HIV testing facilities. I mean, the only way you can prevent HIV as well as if you know that you're living with HIV or you are HIV positive, then you have to be even more cautious about not ensuring that you're not going to pass on the HIV virus to someone else. And lastly, this is the most important point here, is knowledge about how to reduce the risk of HIV is very important. It's critical in HIV prevention. Next, please. So, what are the kinds of knowledge that are needed to prevent? One is here is the ways in which HIV can be spread. And so there's often a misconception. Basically, those three ways are the only ways you can get HIV. Sitting next to somebody living with HIV or AIDS is not going to be of any risk for you in terms of getting HIV or being infected. So secondly, knowing which behaviors greatly increase your risk of exposure to HIV is important. And finally, knowing effective methods to remove or reduce these risks for each mode of transmission is also equally important. Next, please. So in Asia and the Pacific, to give you a sense of why UNESCO thinks that HIV prevention education is so important, is let us look at the figures and statistics coming from the region. So this is sort of the most recent up-to-date data that we have. Most of it's coming from UNAIDS and WHO. So we have 4.9 million people with HIV or AIDS in 2007 in this region, and 440,000 new infections in 2007, and 300,000 HIV and AIDS related. And so basically what we're saying is, if by 2020, we don't scale up our prevention efforts or initiatives, there will possibly be 10 million new infections by 2020 in the region. So that's a very significant number if you think about how large some of the countries are in the region. Of course, aside from China and India, who make up a very large share of proportion of new infections or people living with HIV in the region, 10 million is a relatively large number for new infections by that date. So in Asia and the Pacific, most countries face what we would call technically a concentrated HIV epidemic. And what is that? So according to WHO, the World Health Organization, HIV prevalence, if it's a concentrated epidemic, HIV prevalence must be consistently greater than 5% in at least one subpopulation. That's one particular group. and is less than 1% in pregnant women in urban areas. So for most countries in the region, this is the situation. Next slide, please. Now that and lastly, there was a study recently commissioned by the AIDS Commission in Asia, and the report is available now. It has found that 75% of HIV infections among adults and 95% of HIV infections among adolescents are linked to these three behaviors. The first is unsafe sex in the context of the sex industry, sex workers, or clients of sex workers, unsafe sex between men, and lastly, unsafe injecting drug use. So this is a very important finding because basically the UN family has pretty much considered these findings to be very important and are now key in sort of shaping the work that we're doing in the region. And Secretary General Ban Ki-moon has actually supported, or rather endorsed, this report and the findings in it. So we are now going to be focusing our work more around these three risk behaviors. Next, please. So what is HIV preventive education then? I mean, that's the big question here. It is basically several things. It's the knowledge, attitudes, and skills about the scientific aspects of HIV, the medical aspects of HIV, the social and behavioral aspects of HIV. So the social impacts, why people get HIV, it's behavioral as well, all these different things. And it's also not just this group of knowledge, attitudes, and skills, but it's also the transfer of these knowledge and attitudes to young people, like yourself, both in non-formal and formal settings. So I just want to clarify, formal settings here refers to formal educational institutions like universities and schools, colleges. Non-formal would tend to look at educational settings that basically any educational setting that is not within those places I just mentioned, the university, the schools, the colleges. And this is important because young people, there are young people who are not actually in schools. Those are out-of-school youth for whatever reason. They're out of school and they're maybe working instead of, or they don't have the same opportunities to go to school. It is also important to ensure that those young people as well get essential information and attitudes about preventing HIV. And finally, HIV preventive education is about developing what we would call life skills, which I'll explain a little bit, needed to reduce the risk of HIV transmission, alcohol and drug use, and to help young people adopt healthy lifestyles. We've mentioned alcohol and drug use because we think that these are also key issues relating to young people, and they do affect, and I'll talk about that a little bit later, they do affect oftentimes young people's ability to make decisions. I'm talking about alcohol and drug use, and therefore that does sometimes affect or make young people more vulnerable to HIV transmission. Life skills are basically the skills that people need to go through life, and they're coping skills. They're skills such as negotiation skills, communication skills, handling stress. Those are the various things that comprise life skills. Next slide, please. So why is HIV prevention important? I mean, we talked about the statistics that I mentioned earlier in Asia and the Pacific, but maybe on a global scale, it's good to know that, after 30 years since the beginning of the HIV global epidemic, we still have millions of people at risk of infection. So it's a very large problem on the global scale, and it's not going away anytime soon. Many people have little access to information about HIV prevention and are still largely unaware of the risks. Next, please. So why else is it important? Well, there's often misunderstanding about HIV and AIDS and prejudice against people living with HIV, and negative attitudes towards those who have died of AIDS and their families and people associated with them. So these negative attitudes and prejudices and misunderstandings create situations where people are less likely going to get treated or tested for HIV because of the consequences. If people feel very afraid, if they know that, you know, someone's going to find out that they're living with HIV, then there's a lot of possible consequences at the community level, how they'll be treated. Maybe they're afraid that they'll be rejected by their community and their families. And so people then don't want to go get tested, or they might suspect they have HIV, or they won't go get treatment, if treatment is available, of course. This is a problem because if you know that you might have HIV, but you don't get the proper information to protect yourself, protect other people around you, then there's a very great chance that you might pass on HIV to someone else. So this is very important. And also, the misunderstanding about HIV is very important because there's been a tendency to associate people living with HIV with those that are bad people, or they only do bad things, and only people like drug users or sex workers get HIV. This is a danger, because if you only think that, then you'll think that you're never at risk of getting HIV, and therefore you don't protect yourself. That's the main thing. So finally, accessible and accurate education about this communicable disease is very essential then in reducing risk behavior and HIV infection. Next, please. Why is it important? Young people, as I mentioned earlier on, 95% of young people in the region get an HIV through the three main risk behaviors I mentioned. One is unprotected sex between men, unsafe sex in the context of the sex and sex work, either sex workers or clients of sex workers, and of course that impacts as well families of the clients of sex workers. And lastly, I mentioned unsafe drug use. So young people engaging in those three risk behaviors are very high risk of HIV infection all around the world. Studies suggest that around 40% of new HIV infections are between those that are 15 years to 24 years of age, which tells us that 2,320 new infections occur every day around the world. I mean, can you imagine? That's every day. That's a very, very high figure. It's important to prevent HIV because we would like to promote the health and prevent disease of children and youth, and we'd like to foster behavior that reduces risk and lessens the impact of HIV. Next, please. So why are young people, I've been asked to speak to all of you who are now in university, and why are young people at risk of HIV? That's the question you might be asking me. Because there's still widespread ignorance about HIV, and a lot of people remain uninformed about the most basic facts about HIV and prevention. So young people in general, but in young people I'm talking about specifically, often lack the knowledge, skills, and attitudes needed to protect themselves and to make informed decisions about their sexual and reproductive health, about their relationships, drugs, drug use, etc. Next, please. So, and also adolescence. Adolescence is a time of change, physical change and emotional change and experimentation. You're young, you like to try different things, you're curious, and you want to experience different things. So many young people, and this is based on empirical studies and evidence. We are not just making this up. I mean, many young people are sexually active, okay, and they're not practicing safe sex. And many young people are experimenting with recreational drugs and alcohol. And I said earlier, drug use, including alcohol use, will alter a young person's judgment and ability to make rational decisions or healthy decisions for themselves. And so this can lead to risky behavior and unsafe sexual practices, which again makes the risk of HIV infection that much greater. Next, please. So these are all the reasons why UNESCO is working on HIV. So I'm just going to talk about that a little bit. UNESCO is part of what we call the UN Joint Program on HIV and AIDS. I'm sorry, the phone isn't. UNESCO is part of the